be graphic about it. Take a deep breath in, Tom, and relax. Good. That was perfect.
Be more aggressive if you want. That didn't hurt.
No, I know. That's exactly what I want. I don't want to be aggressive with this. So Tom was climbing off the ship onto a, what do you call the small
pilot
boats?
boat.
Pilot boat, and the boat moved up to you, right? The pilot boat moved up to you.
Combination and
Yeah, he had like a handrail that just jammed him right in the chest, and he was good for a couple of days. He could even swing a golf club, right?
Yeah.
Almost. Then what happened after one night of golf?
And then all of a sudden, it just mid-round, it just took a turn for the worse. It felt like I was being stabbed in the ribs right here.
Yeah, he seized up
on
on
a deep breath. Yeah.
Yeah. So he came in the other day, he called us, and I said, "No, come on over, see it." It was swollen, and it was very sensitive to just palpation, digital pressure. We took a tuning fork on there, and I didn't like the reaction of that, so we sent him out for X-rays. And for good news for Tom, they came back negative, right? So we put a little ice on it, and then we lasered over the rib area, and that was the first time we adjusted you.
Right.
So take a deep breath in now for me, and then breathe out.
Yeah.
How's that feel?
I mean, mild discomfort on the deep breath, mild to moderate. You know, when I hold it.
Yeah.
Right in that same spot, but yesterday I would be doubled over in pain.
Yeah, so just keep putting ice on it at home,
Yeah,
right?
will.
And if you could take a plant-based anti-inflammatory, or you could take some sort of anti-inflammatory over the counter if you're comfortable doing that.
Yeah.
Okay, and then just give golf one more day off.
Oh no, I'm off till next week. I'm going to make sure I give it time to heal. I'm not going to push it.
So come in tomorrow.
Yes.